I was discussing about oral submucous fibrosis, and in continuation with the same topic, I am going to discuss its clinical features, diagnosis and management. So let's start with its clinical features. OSMF in its initial stage will show appearance of erythematous lesion in the oral mucosa, which means the lesion that appear on oral mucosa will be red in color. It is followed by paler mucosa with white marbling, which means that there will be a mosaic appearance of red, slight yellow and white color in the oral mucosa. Later stage shows fibrotic bands located beneath atrophic epithelium. As I have already mentioned that there is increased fibrous bands or increased fibrosis in OSMF, it shows appearance of fibrotic bands beneath the degenerating epithelium. Now, in further stages, the increased fibrosis leads to loss of resilience of oral mucosa, which interferes with speech, tongue mobility and decreased ability to open mouth. So, when a patient comes with the advanced stage of OSMF, he or she will say that I am not able to open my mouth properly. Also, in the advanced stage, there will be smarting sensation and inability to eat hot and spicy food. Smarting sensation means that when a patient suffering from OSMF in advanced stage, he or she when eat spicy food will have stingy pain. Now coming to the diagnosis can be made with the evidence of clinical history of patient's report with the habit of betel quid chewing. The patient will be a consumer of betel quid for a longer period of time. Also, when you palpate the mucosa of patient suffering from OSMF wearing a gloves, it will show palpable fibrotic bands. Also, the mucosal texture feels tough and leathery, and there will be blanching of mucosa together with the histologic features that are consistent with OSMF. So, from these things, you can conclude that the patient is having OSMF. Now coming to the management part, the first and the foremost thing that you have to tell patient is to stop eating areca nut, that is habit cessation. So you have to educate patient that the habit you are from the past 10 to 15 years, you have to quit it. Also, there is plethora of treatment including topical and systemic steroids that are given for the advanced stage of OSMF. The patients are asked to eat food that are rich in vitamins like vitamin A, C, B complex. For the advanced stage, the repeated dilatation with physical devices are done, followed by surgery.